This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome back to the 21st Century Man podcast. Today we're diving into a really meaty chapter from the book.
That's right, Chapter 79, A Comprehensive Approach to Sexual Function by Dr. Judson Brandeis.
And Dr. Brandeis, he's a urologist, right? With decades of experience.
25 years. And you can tell immediately his approach isn't just clinical. It's very holistic, very personal. He connects sexual function to, well, everything else.
So our goal here is to sort of unpack that comprehensive view for you. We want to pull out the key insights, the actionable strategies he lays out.
Because it really is about an integrated approach to male sexual health.
And right at the start, he stresses something critical, the environment between doctor and patient.
Absolutely. Comfort, honesty. He says he can only really help if people are completely open,
He shares this story about a 55-year-old guy with ED.
Yeah, and on the surface, things looked, well, okay. But this story wasn't quite fitting.
It took the patient feeling safe enough to mention a history of drug abuse from way back.
And that was the missing piece. Suddenly, it clicked. That honesty, that openness, it was the key to actually getting effective treatment.
It really hammers home that point you need to be upfront with your doctor.
Totally. That relationship is the foundation for this whole comprehensive thing.
Okay, so let's get into the layers of this approach. It's definitely not just about, writing a prescription. First up, cardiovascular health.
Which is fascinating because he directly ties most erectile dysfunction back to blood vessel problems.
So ED is like a symptom, an early warning.
Exactly. Risk factors we hear about all the time, smoking, diabetes, high cholesterol, high blood pressure. They're not just general health issues. They're major players in ED.
He has this quote in the chapter, something like, "Loss of sexual function is often concrete proof that there is something physically wrong." Really makes you think.
It does. It's like your body's sending up a flare.
And it goes deeper, right?
Yeah.
He connects early ED to potential future heart problems.
Yeah, the data suggests ED can show up 5, even 10 years before significant heart disease becomes apparent. It's a powerful predictor.
Wow.
So that's why he emphasizes checking family history, using tools like heart scans to look for early plaque or vascular ultrasounds for blockages.
So it's not just about what's happening, below the belt. It's a signal about your whole system.
Precisely. And he even talks about how some common blood pressure meds can cause issues down there.
Right, restricting blood flow.
Yeah, so he looks at alternatives.
Yeah.
Or things like boosting nitric oxide. We'll definitely get more into that later. And, simple stress reduction.
It kind of highlights his whole philosophy, doesn't it? He mentions dealing with insurance and stuff, but
when the patient's there, it's all about optimizing that person's health and performance. Full stop. Regardless of constraints, that patient-first focus really comes through.
Okay, so beyond blood flow, the next big piece is conserving nerve function.
Hugely important.
Yeah.
Especially, as you mentioned earlier, for men who had prostate cancer treatments like surgery or radiation.
Even the nerve-sparing kind doesn't guarantee full recovery.
Unfortunately, no. Regaining 100% potency is actually pretty rare. That's why he pushes for early, aggressive intervention right after treatment.
What does that involve?
Things like immediately starting nitric oxide boosters, maybe daily low-dose Cialis, and using a vacuum erection device every day.
The vacuum device. That's for stretching and oxygenation.
Exactly. It keeps the tissue healthy. He also brings in regenerative therapies early on, like low-intensity shockwave therapy and PRP platelet-rich plasma.
We'll touch on those more later, I assume.
We will. But his point is, without that early effort post-surgery, the window for regaining function really starts to close.
Now, here's a twist. I didn't expect the connection to the spine.
Isn't that interesting? Lumbar spine problems.
How does that work?
Well, pressure on those lower sacral nerves, the ones often involved in back pain, can actually interfere with the nerve signals going to the penis.
Seriously?
Yeah, he gives this great example. A 44-year-old guy whose ED vanished after he had surgery for a herniated disc in his lower back.
Wow. So you really have to look everywhere.
That's the holistic view in action.
Okay, next pillar. Optimizing overall physical health. This feels foundational.
It absolutely is. He uses tools like the InBody scale to assess body composition. And there's a big focus on, well, the basics. Weight loss, nutrition, building muscle.
Why the focus on fat specifically?
Because excess body fat, particularly visceral fat around the organs, isn't just dead weight, it's metabolically active. It actually produces estrogen in men.
Which isn't great for testosterone levels.
Exactly. And it limits your ability to exercise effectively. So the goal is often getting body fat below 20%. But his realistic calorie restriction is tough.
He calls out alcohol, doesn't he?
Oh, yeah. The empty calories from alcohol are a major roadblock for a lot of guys trying to lose weight. He aims for sustainable loss, like maybe a pound of fat a week.
What I liked here was how he adapts his communication style.
Yeah, that was great. Some guys, like engineers he mentions, want the data, the numbers.
But then there's the story of the 68-year-old CEO.
Yeah. Who needed a more direct approach? A wake-up call.
Looking him in the eye and saying, "What are you doing?"
Apparently it worked. The guy got motivated, lost weight, got fit, even started hiking with his wife again. It shows he connects with patients on their level.
He gives concrete exercise advice too, right? Cardio, strength.
Yep. 2-3 days of cardio, 2-3 days of strength training.
Yeah.
He seems to like circuit training efficient, a less risk of injury.
And building muscle isn't just for looks.
Not at all. More muscle means a higher basal metabolic rate. You burn more calories just existing. Plus, feeling stronger and fitter. That often gives libido a real boost. Improves self-image, too.
He mentions M-Sculpt too, for those with the resources.
As a potential shortcut or boost for building muscle mass quickly, yes.
And underlying all this is comprehensive blood work.
Always. Before jumping into treatments, he checks everything. Kidneys, liver, blood counts, vitamin D, B12, PSA for prostate health, electrolytes, thyroid.
And, crucially, testosterone, both total and free testosterone.
Right. He calls testosterone critical for so many things: libido, energy, focus, sleep, performance, building muscle, burning fat. The list goes on.
Has his approach to testosterone therapy changed?
It seems so. He mentions he used to be more conservative, aiming for just normal range. But now he finds optimizing levels, often aiming around 1,000, brings much better results for how men feel and function.
Are there downsides?
He acknowledges potential risks, like prostate growth or maybe hair loss, but feels that for many, the benefits, the improved quality of life, really outweigh those. He says he gets way more positive feedback than complaints.
Okay, changing gears completely now, but just as important in his view, relationships.
Oh, absolutely. He always delves into this because relationship dynamics have a massive impact on sexual function. He even notes seeing issues more often in recently divorced men.
But he makes the point that I thought was really insightful and maybe easily missed.
Which one?
The health of the partner's genitalia.
Ah, yes. That is huge and often completely overlooked.
He tells that story about the patient who got his function back.
Right. The guy's erections were working again, but intimacy was still painful because his wife, who is 68, and post-breast cancer treatment.
He couldn't use estrogen and had significant vaginal dryness and narrowing.
Exactly. Imagine going through all the treatment for ED only to hit that wall. It really highlights the need for communication.
So what's the practical takeaway there?
Well, he started proactively giving patients good quality silicone-based lubricants, like Uberlube he mentions, and strongly encouraging them to talk to their partners about vaginal health, about seeing their doctors, maybe discussing estrogen options if appropriate.
And that specific case led to more content in the book.
Yeah, it prompted a colleague to write the chapter on menopause for the 21st century man. It shows how these issues are all interconnected.
It all comes back to understanding the patient's whole life, doesn't it? Their relationship status, their history, and setting realistic goals.
Definitely. And of course, you can't talk about this without addressing the psychological side.
Anxiety and depression.
Major factors. Anxiety pumps out adrenaline, which is basically the enemy of an erection. It diverts blood flow away.
Yeah.
And depression just craters libido.
Plus, the impact of medications needs attention.
Especially SSRI antidepressants, things like Zoloft or Paxil. They're notorious for causing ED and problems with orgasm. He notes that sometimes just switching the antidepressant can fix the sexual side effects. He refers back to chapter 77 for more on meds.
Okay, so after covering all that groundwork, circulation, nerves, overall health, relationships, psychology, he gets into specific treatments, particularly regenerative ones.
Starting with shockwave therapy, which he was apparently an early adopter of for ED.
How does that work, in simple terms?
It uses focused sound waves, basically acoustic pulses, aimed at the penis. It creates a kind of controlled microstress.
Stressing the tissue to heal it?
Sort of, yeah. It wakes up dormant stem cells in the area and triggers the release of natural growth factors. The big goal is encouraging the growth of new, healthy blood vessels, angiogenesis. Better blood flow.
And the results depend on how severe the ED is initially.
Pretty much. For mild cases, maybe guys can ditch the pills. Moderate cases, the pills like Viagra might start working much better. And for some severe cases, it might restore enough function to avoid needing injections. Chapter 80 is all about this, actually. Wave goodbye to ED.
He also puts a massive emphasis on nitric oxide, says it's critical but often overlooked.
It really is fundamental. Our natural production drops as we age, and nitric oxide is the key molecule for relaxing blood vessels and allowing blood flow. Everywhere, not just the penis.
That's why athletes use boosters.
Yep, improves circulation, oxygen delivery. He even notes it helps mental sharpness because the brain uses a lot of nitric oxide.
And he developed his own supplement for this.
Based on his research into the pathways, yeah. It's called Affirm, designed specifically to boost nitric oxide production.
Then you have the drugs most people know. Viagra, Cialis, Levitra, the PDE5 inhibitors. Where do they fit?
They work hand in hand with nitric oxide. The PDE5 enzyme breaks down the molecule that nitric oxide uses to signal vessel dilation. These drugs block that enzyme, but only in the penis.
Ah, so they make the nitric oxide signal last longer and work better, specifically there.
Precisely. You still need the initial nitric oxide signal from arousal. He also mentions using low-dose daily Cialis, like 5 milligrams in the evening,
Why daily?
to help promote those natural nighttime erections. He sees maintaining those as really key for keeping the erectile tissue healthy long-term, sort of like exercise for the penis.
What about men for whom pills don't work, maybe due to nerve damage or really severe vascular issues?
That's where injection therapy like Trimix comes in.
Trimix. That's a mixture of drugs.
Usually 3. Papaverine, phentolamine, and prostaglandin E1. It's injected directly into the side of the penis.
Ouch. But effective.
It bypasses the usual nerve and blood flow pathways to directly cause an erection. It's very reliable, but obviously requires careful teaching on how to inject safely.
And there's a risk.
The main risk is priapism, an erection that won't go down and needs medical help. That's why they start with tiny test doses. It lacks spontaneity, but for some guys, it's literally the only thing that works. Chapter 81 goes into more detail on various meds and supplements.
He also really likes the vacuum erection device, the VED or penis pump,
Yeah.
especially for guys missing nighttime erections.
Yeah, he sees it as replacing that natural nightly process of stretching and oxygenating the tissue, which happens during REM sleep erections for like 30, 60 minutes typically.
So using the pump mimics that.
That's the idea. His suggested routine is often 5 cycles, holding the erection for about a minute each time, morning and evening. He calls it maybe the least expensive, most effective intervention for just maintaining tissue health, size, and function over time.
And you can use a ring to keep the erection for sex.
Yep, a silicone constriction ring at the base. Chapter 82 covers pumps in more detail.
Okay, then there's the P-shot, platelet-rich plasma.
Right, PRP. This often follows shockwave therapy in his protocols.
So shockwave stimulates and PRP feeds.
That's a good way to put it. Platelets aren't just for clotting. They are packed with growth factors, over 140 different ones, including factors that promote blood vessel growth.
And the process is drawing blood, spinning it down?
Yep, draw blood, use a centrifuge to concentrate the platelets, then inject that PRP concentrate back into the penis, usually with ultrasound, to guide it precisely.
He calls PRP fertilizer for the stem cells woken up by the shockwave.
Exactly. There's some data showing PRP helps ED on its own too, and he mentions he's running a study combining PRP with other things, traction, suction, his Affirm supplement, looking at improving not just function, but potentially length and girth too. Chapter 83 is where you'd find more on PRP.
For some men, especially maybe younger guys after prostate cancer or those with severe diabetes, an implant becomes the conversation.
The inflatable penile prosthesis. He actually calls it a curative treatment because it provides a completely reliable, on-demand erection.
It's all internal, right?
Totally internal. There's definitely a psychological hurdle for some guys, but he notes the satisfaction rates after placement are incredibly high.
And he works with an expert on this.
Yeah, he refers to Dr. Ed Cartman, who wrote Chapter 85 on implants. Dr. Brandeis trained with him, and apparently the procedure itself is often pretty quick, maybe 20 minutes, and outpatient.
Okay, almost there. He also includes pleasure aids, sex toys.
Which might seem basic, but it's practical. As nerves become less sensitive with age, sometimes you just need more stimulation.
And he recommends a specific brand.
Fun Factory. Says they're high quality, designed by an engineer. His point is, there should be no shame. Women use vibrators all the time without stigma. Why should it be different for men? Chapter 86 talks more about toys.
Finally, he touches on creative solutions. What's that about?
It's an acknowledgement, really, that even with everything, not every man will achieve erections firm enough for traditional intercourse.
So finding other ways to be intimate.
Exactly. And he makes the point that some of his happiest, most sexually satisfied patients are couples who've gotten creative and found other fulfilling ways to connect physically and emotionally. He even points to Susan Bratton's chapter 88, on how to please a woman, reinforcing that great sex isn't solely dependent on the man's erection.
Okay, so if we bring this all together, Dr. Brandeis's goals seem pretty clear.
Yeah, feel good, look good, and have great physical intimacy. That sums it up.
It's this incredibly comprehensive, long view plan, not just fixing ED, but building lifelong health and fitness, including what he calls erectile fitness.
And the underlying message is powerful. Improving blood flow and nerve health for the penis benefits your entire body, your heart, your brain.
And helping men reconnect intimately boosts happiness, strengthens relationships. It has ripple effects.
Which leads to his final thought in the chapter, which I really like. Happy, healthy men make great husbands, fathers, professionals, leaders, and neighbors.
Wow. Wow. The breadth and depth in this single chapter are incredible. It really drives home what comprehensive means in this context.
It absolutely does. It
Yeah.
gives you a real sense of the value packed into the 21st century man as a whole resource. We've, hit the highlights today.
For sure. There's so much more detail, more nuance in the chapter itself. If this topic interests you at all, we really, really encourage you to grab the book and read chapter 79.
Definitely worth the read to get the full picture.
Thinking about all this, maybe the most profound takeaway for me is how male sexual function isn't just this isolated thing.
Right.
It's like a barometer, isn't it? Reflecting overall physical health, mental state, even the health of your relationships. Addressing it comprehensively, like Dr. Brandeis suggests, is really about investing in your whole life.
Well said. It truly is interconnected.
Well, thank you for joining us for this deep dive into Chapter 79 of The 21st Century Man.
And definitely join us next time as we keep digging into the book with Chapter 80, the one titled Wave Goodbye to ED. Should be interesting.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.